Our guest, who writes in the New England Journal of Medicine that in every week in the year 2022, the equivalent of an entire high school class of students died of overdoses in the United States. Dr. Scott Handlen joins us now, Chief of Adolescent Medicine at Mass General and Associate Professor of Pediatrics at Harvard. All right. I mean, that's just almost purposely slowed down there to almost process what that is. I mean, think about that every single week. Pick up on what you found.
Yeah, it's really concerning. You know, there actually has been a change in the things that cause death in children in the United States, where now for children under the age of 19, the #1 cause of death is guns. The second most common cause is motor vehicle crashes, but the third most common cause of death among kids in the US now is overdoses and poisonings, and most of these are caused by fentanyl. And so this is now killing more kids each year than cancer and all kinds of other conditions that we as pediatricians spend a lot of time thinking about.
All right, I'm going to kind of look through a few things here on numbers, and then maybe you can give us your analysis and what we can do about it. So first of all, the first on the tablet, we have the national drug overdose deaths, and I think the spike that we'll see when this chart comes up is fentanyl. So this is around, and I kind of pointed out here, 2016, right? I think that's fentanyl right in there. Now, the other points I want to make, you look at overall deaths, national drug overdose deaths, no matter what your age is, they've been going up for years across the board. When we talk specifically, we'll get into younger people, about, say, high school students. This chart's interesting to me, but maybe you can talk about it. It looks like things were going down. This is 12th graders until it actually decreased from 21% in 2002 to 7% in 2001 on this, but then rebounded. That's fentanyl, right? Right at the end. So we were making progress. Is that true, Dr. Handlen?
Well, what's really shocking about these numbers, that last figure that you show here actually shows that for the last couple of decades, drug use among teenagers has been on the decline. So actually there's fewer high school seniors graduating from high school who have ever tried illicit drugs before. And yes, there's that small uptick at the end, but overall, there are fewer that are experimenting than ever before. And yet, overdose deaths are skyrocketing. So what's happening here is that even as fewer people than ever, adolescents, use drugs, more than ever are dying, and it's because fentanyl is such a highly potent opioid. It's at least 50 times more potent than heroin, and so it can really contribute to an enormous number of overdoses across the country. And I see this all the time in my clinic, where I care for young people who struggle with addiction, and what they're seeing is a drug market that's really awash with fentanyl right now.
You know, it's amazing. That chart only went back to, I think it was '02, right? But you think about back when we were little kids, you had the Nancy Reagan just say no, but your point is it's been around forever, and that first chart, I guess, maybe showed that drug use in America has been a problem forever. But this kind of problem, the fact that you don't know what you're getting, you might try something for the first time, and that's literally the end. That's, I guess, the new part. It's not like it wasn't ever there, but that's the newest part for these young kids. They have no idea what they're getting into.
That's right. I talk to families all the time as part of my work and in my advocacy across the country. And I've met lots of families who have exactly that story, that they had a young person who tried a pill maybe just once, maybe twice. And because it's so potent, there's just such a high risk of overdose. And so young lives are being tragically lost at really an unprecedented rate. Part of the issue here, too, is that fentanyl is showing up in all kinds of unexpected places. And the place that it's probably most deadly for young people is that there's a market for counterfeit pills in the United States, meaning pills that look like oxycodone or Xanax, medications that are used to treat pain or anxiety. And these pills are counterfeits. They're fakes. They're created outside of the country, brought into the United States, and they contain fentanyl because fentanyl is cheap to import into the country, highly potent. And so you can, if you're a distributor of drugs, you can make a lot of money using very little drug. And so these counterfeit pills are everywhere. And it turns out that many young people don't know that these counterfeit pills are out there. They think they might be taking something else that's a painkiller or an anxiety relieving medication. And then they overdose.
Man, it's just so sad. Thank you for the information. Maybe a quick thought on what we can do. We got to go here in a minute, but a quick thought on if we're making any progress, anything we can do here.
Well, let me tell you, one quick tip for parents is to make sure that you have naloxone in your house. So naloxone is, actually have some here, an easy to spray up the nose opioid reversal drug that parents can have it home. You can buy it over the counter at the drugstore. Your doctor can prescribe it, and it can save a life within minutes. And I encourage all parents to keep it at home and carry it with them. Encourage their kids to know how to use it in case of an emergency, because it is just so effective. It's inexpensive, and just like a fire extinguisher, something that we have in the house, even though we don't ever expect to have a fire in the home, we want to be prepared in case of emergency.
Well, fentanyl overdoses have become the #1 cause of death for adults under 50. And more it's being mixed with other drugs. Oftentimes, the user is never even aware. Correspondent Nancy Liu is live in Los Angeles. Nancy, is this expected to get worse with the holidays right around the corner?
It's quite possible, Nicole. The crisis keeps getting harder to fight, with fentanyl getting mixed in with new street drugs and more victims taking it unknowingly. It's estimated that there are now about a death about every 10 minutes, and the holidays could claim more lives even faster.
Ho, ho, ho.
The most wonderful time of the year is quite the opposite for many, and a nationwide shortage in prescription drugs like Adderall has some health experts concerned.
Unfortunately, there are things available on the street that will work in the moment for them and make them feel better and get through the season.
A simple text or call can make all the difference.
That's truly what people are looking for during the holiday season, is that connection with people who care about them.
With traffickers making bigger and faster money by pushing products with fentanyl, any drug off the street is like a round of roulette.
Whatever you think you're about to smoke is very likely laced with fentanyl. Whatever drug you think you're about to shoot into your veins or take into your body any other way, you have to assume that it's laced with fentanyl.
By now, there are countless pills all over the U.S. disguised as prescription drugs such as Percocet, Adderall, OxyContin, and Xanax. Fentanyl has even been detected in candy and gummies.
They're going to continue to get very creative because it's a business.
More illegal product is coming in every day, much of it from Mexico. This stash of pills found recently inside a truckload of coconuts. A grieving father sharing his pain and concern just this week, along with the LA County Sheriff's Department.
There's not a drug dealer today that doesn't know there's a possibility the person they are selling to might die.
And due to traffickers developing new illegal drugs that are more colorful and edible, experts fear an increase in deaths among even younger victims. So once again, parents are urged to discuss this crisis with their children. And Nicole, that also includes a warning about sharing candy between friends.
Yeah, we hate to see when anyone is affected, but particularly children. Okay, Nancy, thank you.
We know that fentanyl is flowing into the U.S. from Mexico, contributing to the overdose crisis in this country. It is the leading cause of death for people 18 to 45 years old. And a recent study also finding 40 infants were killed by fentanyl over the course of a year, more than twice as many toddlers, and more than 1,500 children and teens in total became victims. Now, one American drug maker is hoping for a breakthrough to prevent loss of life. They are just about to begin human testing now on a first-of-its-kind fentanyl antibody treatment. And it aims to attack fentanyl in the bloodstream before it ever has a chance to reach the brain. We are welcoming in Tracy Woody, now CEO of Cessation Therapeutics, behind this new trial. Tracy, thank you so much for being here.
Thank you, Natasha.
Can you help us understand how this treatment works? How does it prevent overdose?
Yeah, sure. So monoclonal antibodies have been around for a very long time, since the mid-'80s, in medications for things like migraines, high cholesterol, and even cancer. But they've never been used or tested in things like substance use disorder. So this monoclonal antibody is a little bit of a change in thought. This is a preventative treatment. So a patient would receive this monoclonal antibody. It would stay in the blood for about 30 days, Natasha, and it would sit in the blood and almost act like a Pac-Man. So if fentanyl ever enters the system, it essentially grabs fentanyl and does not allow it to ever reach the brain, where it exerts its most powerful effects, namely loss of oxygen, and that's how you die from an overdose. So this monoclonal antibody would allow this for fentanyl to never actually enter the brain, where it produces its most harmful effects.
It's very interesting. And so you mentioned that initial indication, the protection may last about 30 days. How would it be administered?
Yeah, great question. So there are about the people that are most risk for an overdose in this country. The vast majority of overdose deaths occur among people who are addicted to opioids. So there's just over about 3 million people in this country that have opioid use disorder. Again, those are the people that are most likely to overdose. And so about just less than 2 million of those are being treated by a healthcare provider. So this drug would be administered by a healthcare provider in a physician's office or just post an overdose, which is another vulnerable time for an overdose. And again, this drug would last about 30 days. And that seems to be a good period of time. These patients are typically seen at least every 30 days for a check-in. We will prove that out in humans in the upcoming trials.
Okay, and you know, it does seem different than Narcan, which of course so many officers carry now to help prevent or reverse overdose that they encounter. Narcan given after the fact. This therapeutic would be given before the fact, sort of as a prophylactic. Can I ask, if these next trials do go well, what is the minimum timeline until doctors can actually start administering this?
Yeah, great question. I did just want to comment because you made a great point, Natasha. Narcan is a great drug and it's widely available. But despite its wide availability, even being over the counter, we continue to have, you know, this vast majority of deaths, growing deaths due to fentanyl overdose. So we see it as a great drug. But this is different. As you mentioned, it's preventative in nature because fentanyl can kill in just 2 minutes. And with Narcan, you need a bystander, and sometimes that bystander is just simply not there. But we will be touching on every expedited approval process we can with the FDA. And if all goes well, we would hope this drug would get approved at the end of 2025, beginning of 2026.
Okay, and we know you'll keep us posted. We appreciate you joining us and giving us this update. Tracy Woody, CEO of Cessation Therapeutics, thank you so much.
Thank you, Natasha.
A 1-year-old kid just making it to his 2nd birthday. Didn't get there. Why? Fentanyl. The daycare center was a front. Oh, I can't believe it. How could they? It's been done before. Dealers back in the day, I remember when they were moving small packets around impoverished areas, they used to love putting them in kids' carriages, diapers. This isn't new. And it's not an easy stop, man, but I'll tell you what, if a baby overdosing had to be administered Narcan, some survived, one didn't. If you can't get up in that and rally around us and get us behind you to spend the money and do the things and change the rules and whatever it involves, what is there? What else matters compared to this? That's why they don't talk about it. And it's going to happen again. And it's going to be kids. Why? Because it's affecting everybody right and left. Okay? No party has an advantage on this. And I want to tell you how real the problem is, okay? So here's what we know. This is it, right? To find the drugs in the daycare center, right? It's a drug den. That's what it doubled as. Not surprising, okay? Kilo of fentanyl they found. Maybe they found more, but whatever. A kilo is so much more powerful than other drugs that a kilo has like 10, 15 times the killing power. Sickening, but that's where we are. And if you thought this was rare, I'm telling you, you're wrong. I'm telling you, they're dying. They're getting in the emergency room all the time because of fentanyl. Red states, blue states. An emergency room pediatric pharmacist lives this firsthand. Cody Peterson knows the reality. Cody, you make an interesting point. You make many, by the way. It's not an awareness issue. Everybody knows fentanyl bad. They just don't know where the fentanyl is and how much of it they could tolerate if they're even told about it. And we don't have the tools to fix it. You know, Narcan's all we have, and it can or cannot work. And you see it all the time. And you say that this is more than can be handled.
Well, what I can say is this: the opioid epidemic is raging on. We had over 100,000 deaths secondary to opioids, over 70,000 of them related to fentanyl just last year, or 2021 perhaps. And so the opioid epidemic rages on. In fact, it's the worst it's ever been. And this is after 52 years of a drug war that has raged on and continued to ravage these same impoverished areas that are dealing with this fentanyl crisis. This doesn't fall across party lines. It really doesn't. The drug war never really has, but it is a war on people that has failed. We have led ourselves down this trail, and instead of addressing the problem, we continue to try to enforce and police drugs.
So that's the policy side. Your expertise is what you see. And what is the reality of kids and fentanyl and people coming in shocked that they had fentanyl?
Yeah, well, I mean, to be honest, most consumers of opioids, most opioid addicts know that there's a chance that fentanyl is in their product, but most don't have a tool to measure how much fentanyl. They just kind of hope that it's the right amount. And in the pediatric hospital that I work in Southern California, we see overdoses from numerous medications, but increasingly so fentanyl. And that's for multiple reasons, but mostly fentanyl's never been more prevalent than it is right now. So I would say nearly weekly, we're seeing a pediatric patient, usually between 0 and 5, who managed to accidentally consume a pill that fell on the floor, that they accidentally swallow. And then because it's so illicitly produced and so inaccurate in its production, we don't know what to expect. We don't know if it's a fatal dose or if the patient will, not even have an issue.
You know, Dusty, my EP just got in my ear, and she said, yeah, remember the case that we covered about the family in the BRBO, the rental, and whoever had been there before them was partying, and a 9-month-old kid must have touched it, and just exactly like you said. And what, in your experience, tells you what will work and what won't work?
Well, what won't work is what we've been doing for the last 52 years, which is just enforcing drug laws. We sort of created this epidemic. In fact, fentanyl inherently is created. It was first synthesized by pharmaceutical companies in the 1960s. And right now, the only tool that you mentioned that we have in our tool belt is naloxone, which is, again, a pharmaceutical. And so in my experience, pharmaceuticals are not going to dig us out of this hole. We've been doing this for 20 years. We need more access to fentanyl. It's a tool. We need access to fentanyl strips. It's a safety measure. But we also need to get to the root cause. You can't stop a supply and demand problem by only attacking the supply side. We have to address the underlying reasons people are reaching for these drugs.
As the fentanyl crisis continues to devastate communities across the United States, China's role in fueling this epidemic increasingly coming to light. China is accused of enabling the cartels by supplying the precursor chemicals that are needed to make fentanyl. Federal investigators in this country adding China is, quote, not only an active participant in the drug trade, they are directly incentivizing it. New York Congressman Richie Torres saying up to 97% of the chemicals needed for fentanyl are coming directly from China. Despite this, China itself does not appear to be facing a similar drug crisis within their borders. So what is China's responsibility in this public health emergency, and how will things change with a new administration heading to the White House in just 29 days? We're welcoming back to NewsNation Prime Dr. Robert Marbut. He is the former White House homelessness czar and senior fellow at the Discovery Institute, also producing the documentary Fentanyl Death Incorporated. Doctor, it's good to see you again. Thanks for making the time.
Thank you for having me on, and most importantly, thank you for caring about the fentanyl crisis.
Oh, we deeply care about it, and I know there's no American community not touched by this. Last time you were on the show, you said that we need to learn from how China has managed their own drug crisis. Tell me more about that. What lessons do we need to learn from China?
Well, I went, as part of dealing with the movie, I went over to China and spent 3 weeks there sort of fact-checking all the data and research I found. And what's incredible, on a percentage of population basis, China is less than 1% with the illicit drug use. Our country has over 1/5 use in a year. and 13% just in the last month in terms of illicit drugs. So you go, why is that? Well, first, China has very, very strict about both consumption, distribution, and possession, whereas the United States, many parts of the United States practice harm reduction, where we actually use taxpayer dollars to help you do the drugs. The second thing is they have mandatory rehabilitation to get into their programs. We, on the other hand, barely fund that. And then the third area is they spend a lot of money, government money, spent on government awareness and education, and we almost have no education at all. You'll see some signs about cigarettes, but you won't see any signs about fentanyl. And those three things are the big differences between what China's doing and what we're not doing.
Thank you for outlining that. I want to pick up on that first point you made and get your opinion on a policy that Trump has been considering, which is quick trials for drug dealers. The president-elect saying that he has no problem if the U.S. captured, tried, and even executed drug dealers within a short period of time. And he adds that this would be similar to the justice system in China. Doctor, do you agree with this?
And that's very similar to what goes on in China. And you obviously have to have due process and make sure you get the right people. But the most important thing we need to have is very strict and certain punishment for wholesale drug dealers and major retail drug dealers. Right now, many parts of our country, we actually have formal policies that have decriminalized drug distribution. And I'm actually sort of positive in one way. California citizens voted 2-1 to reverse their state legislature's decriminalization of hard drugs. So the voters in California, not a conservative, red state, they actually voted to recriminalize high-end drug use. So I think our country's ready for that. And so we have to have very strict punishment, and we have to have very certain punishment.
Yes, a strict punishment. I hear that, Doctor. Do you agree with execution with the death penalty for drug dealers?
It depends on the cases, but there's definitely some cases that's probably the right way to go.
Okay.
And it depends on the supply amount, how much, where, and all that. And so you'd have to look at that on a case-by-case basis. But we know that works, and that works in China. And right now, we're making it where it's decriminalized in so many parts of our country.
Yeah,
and
Doctor, with the time we have left, also with your experience as the former White House homelessness czar, if you could wave a magic wand and make one sweeping change to address the fentanyl issue and the connected homelessness issue in our country, what would you do? What action would you take?
Right now, we make it so easy to get high and so hard to get treatment. And I'd flip that on the head and make it where it's easy to get treatment and hard to get high.
How would you do that?
Well, one is by the laws. One is by changing the culture. One is by education. But most importantly, you got to start with the laws, because right now we're making it where we're saying, go do drugs, go distribute drugs, go wholesale, do it. And if anything, you get a slap on the wrist, and you get no criminalization, no enforcement of the laws when the laws do exist. And in many parts of the country, we don't even have laws against massive wholesaling of high-end drugs.
Dr. Robert Marbit, appreciate your time as always. Thank you so much. Happy holidays.
Welcome to Banfield. Get ready for mass overdose events right across the United States of America. A frightening and frankly shocking warning to all of us from the U.S. Drug Enforcement Detachment today. They sent out an alarming letter to every federal, state, and local law enforcement agency, warning them about a nationwide spike in drug overdoses and alerting them to an unprecedented rate that Americans are dying. And it is all due to a dangerous secret ingredient being added to drugs that many of us already take. Pills that have flooded the market and look exactly like the prescription drugs you might have in your home right now. The secret ingredient making its way into these pills is fentanyl. I know you've probably heard about it before. It is the drug that killed celebrities like Tom Petty and Prince and the actor Michael K. Williams. The CDC says in a one-year period, more than 105,000 Americans died of drug overdoses, and about 2/3 of them were because of the synthetic opioids like fentanyl. That is more than all gun and auto deaths combined. But there seems to be a new trend with fentanyl. The government says ODs are about to get worse. This week, officials announced the arrest of 2 alleged traffickers in Orange County, California, who had enough fentanyl to kill 4.7 million people. That is more than the entire population of Orange County, which is only 3 million people. And the national numbers, they are even more worrisome. Last year alone, the DEA seized more than 15,000 pounds of fentanyl. And if you're wondering, that is enough to kill every single American. Let that sink in. That's nearly 330 million people. And the reason for this is that fentanyl is unbearably potent. It takes just 2 milligrams of fentanyl to kill the average person. 2 milligrams. That amount can fit on the tip of a sharpened pencil. This year, the feds have already seized more than 2,000 pounds of fentanyl. And may I remind you, it is only April, and that's just what they seized. So imagine how much more fentanyl has slipped through the cracks, or will slip through the cracks, into our communities. Now, you might be thinking, I would never take fentanyl. This doesn't apply to me. Well, guess what? The people who overdosed on it did not know they were taking it either. The dealers are increasingly spiking counterfeit pills with fentanyl. This year alone, the DEA has seized more than 1 million counterfeit pills. They are pills that are made to look like pills we know well: OxyContin, Percocet, Vicodin, Adderall, and Xanax, even, and I hope you're sitting down, Tylenol. Fentanyl is up to 100 times stronger than morphine, and the dealers hope that by slipping it into these pills, they can get people hooked so that they'll keep buying the drugs. And if you think you can spot a counterfeit pill, I have a little test for you. On your screen, 2 photos of Xanax pills. One is real, a prescription drug used to treat depression and anxiety, and the other one is a counterfeit pill made with enough fentanyl to kill you. So which one's which? The yellow pill, if you said so, that is the counterfeit one. So you'd be correct if you chose the yellow one. But let's try this little exercise with 2 other pills. Again, they both look like oxycodone. That's a painkiller described by doctors regularly across the country. So which one is safe to take? If you picked either of them, you are wrong and you could be dead. They are both counterfeit and both contain fentanyl. But as you can see, they look virtually identical to the real prescription pills. The grave concern for the DEA right now, high school and college kids who are buying what they believe to be prescription drugs online, only to discover much too late that they have been sold a lethal amount of fentanyl instead. I want to bring in 3 people who unfortunately know about this topic all too well. 2 of them lost children to fentanyl overdoses, and the other co-founded an organization called Mothers Against Drug Deaths because of her daughter's experiences with drug use. Michelle Leopold, Gina McDonald, and Amanda Eubanks, thank you all 3 for being here. And I am so sorry that it's under these circumstances. I certainly hope that the conversation we're about to have is going to help a lot of other people to know what the experiences are and maybe learn something and protect themselves. So Amanda, if I can begin with you, I'd love it if you could just share with me what happened to 13-year-old Luca Manuel. That's your son.
Yes. Luca had spoken with a Snapchat dealer several times, and he gained his trust by selling him marijuana. And then my son was offered a Percocet, and unfortunately, it wasn't a Percocet at all, but pure fentanyl. There was no Percocet in the tablet whatsoever.
And Luca didn't survive, did he?
No, he was found unresponsive in his room.
So, Amanda, it's a story we are hearing far too frequently across this country. Michelle, are there any similarities to your son, 18-year-old Trevor, and what happened to him?
Absolutely. Trevor had a similar story. However, he had started smoking marijuana when he was 15 years old and became addicted, so much so that he actually got a cannabis use disorder diagnosis. And he ended up dying in his dorm room as a freshman at Sonoma State, California, in November of 2019 from a blue 30, now better known as dirty 30, I understand, which had a lethal dose of fentanyl in it as well.
And once again, he had no idea that this dirty 30 was a fentanyl pill?
That's a good question. It's a possibility that he was, because he was addicted. Mostly marijuana is his drug was his drug of choice. So he was trying other drugs, but he kept on going back to pot. But I believe he was looking for a higher high, and he's not here to answer the question, did you know that the drug that you bought was likely containing fentanyl?
And this is what the Drug Enforcement Agency is trying to get the message out about. Most kids don't. They think they might be taking an innocent perk, which isn't innocent, but they might think it is, or an Oxy, or Xanax, or something like that. So Gina, tell me a little bit about your daughter, Sam. She survived her drug experiences, but walk me through your world when it comes to this.
Yeah, so my daughter is 24 years old. She too started in high school smoking weed. And I don't know that so much it was an addiction, but I mean, I considered normal drug use. After high school, she moved on to cocaine. We put her into treatment, rehab. We thought she was doing well. We put her in a SLE, which is a sober living environment, where she came in contact with heroin and relapsed with heroin and was out on the street using heroin mixed with fentanyl just up until 4 months ago, where she is now back in treatment, and we're hoping all goes well.
I hope so too. You know, I'm sure everybody on this panel feels the same way, that we're really praying for you and your family. Amanda, your story, you did everything right with 13-year-old Luca. You did everything right. You discovered the marijuana use. You got counseling for him, which not a lot of parents would do right away. I mean, you seem to have done, you know, extraordinary steps to try to protect your little boy. What message do you have for the rest of us out there who we really don't know how to navigate this?
Well, I mean, like you said, I did everything right. You know, we did get him into counseling and we did all the things, but we did not know that illicit fentanyl was in the drug supply, or that it was so readily available on Snapchat. I mean, we had no idea. And that's why I share his story. We talked to him about his marijuana use, and we explained brain synapses and all of the things to discourage him from even doing that. But now, you know, the paradigm has shifted. So I really encourage parents to have open, honest conversations with their children about fentanyl poisoning and the true dangers of doing drugs. Because now it's being found in everything. And there's no safe bet unless it's from a pharmacy or a dispensary. And children can't usually get drugs from either of those places. So
yeah, and you know, there is also something that, you know, a lot of people who are, say, over the age of 40 or 50 might not realize, and that is that the marijuana today is not the marijuana of yesteryear. It's certainly not the marijuana of the 70s, 80s, or 90s. It's, you know, some people might call it the gateway, but a lot of other people are saying it's actually the red carpet, because it is just so incredibly strong. And you know, it's been said, and I've heard it tonight, looking for the bigger high. So, Michelle, you know, what do you think is the answer with regard to this? Because pot's being legalized in a lot of places, and I'm not here to come on the air and say one thing or the other about that political debate. A lot of people would say alcohol is far more deadly, but we are talking about our children, and particularly your children. So, Michelle, give me your thoughts on that.
Thanks, Ashley. When Trevor first became addicted, then I immediately set out because his actions around marijuana was not what I remembered the stoners in high school to be. He was not laid back. He was not calm, cool, mellow. And it was when he was coming down from this high potency THC that he really became out of control. And I learned that the pot from when I was in college or high school was 2 to 4% THC. And today's regular marijuana is 10 to 25%, just a joint, the flower. And if you get the high potency dab or shatter or butter or even some vape cartridges, it can go up from 75 to 99% THC. So this is nothing compared to what our pot was when we were in high school. And similarly, it is causing people to seek out higher highs because you're becoming used to this very, very high from just pot. And part of the problem with the legalization is it's happening faster than the science. And so the science is now proving in places like Colorado that has several years that it is harming, especially the kids. I also am happy to not get into the political debate for 25-year-olds and older, but for people under 25, it has been proven that it will affect your brain. And it's all about the youth access to the high potency THC and then leading to higher highs. And people like Luca and Trevor experimenting as teenagers do and ending up dying from one pill. So I hope that answered your question.
That's what's so difficult is hearing what the DEA is saying today. I mean, you don't usually have the DEA sending out alarming letters to every single law enforcement agency at the local, state, and federal level. I mean, this is a very big wake-up call, even though we've been hearing about fentanyl for years, even though I'm sure people know fentanyl is more, deadly than heroin. They know the stats. They've heard the stats. But to hear that there are these mass overdose events that we should be expecting across the country, it's just overwhelming. And then to know that these counterfeit pills are so hard to determine. Gina, I want to ask you about your daughter, Sam, and if she's been able to help you navigate a little bit about the tricks of the trade, especially for parents who are wondering, well, how am I supposed to know? How am I supposed to figure out if I've got stamped counterfeit oxy pills in my kid's pencil case, or if they're really, laced with something lethal? There's so many questions in that question, but where do we even start?
Right. So going back to what you were saying 1 second ago, Ashley, we're talking about these mass overdose events, and where I'm from, in the San Francisco Bay Area, we are having 2 people a day die from overdose on the street. And in January and February, 98 people have overdosed. And yes, these are addicts on the street, like my daughter was, but our local governments are doing nothing. We have whole areas of the city that are being run by drug dealers. I'm a recovering addict myself. My daughter's tricks, yes, she has helped me. She wasn't so much into the pills. She went straight to the heroin. She knew what she was doing. This was not a poisoning for her, but she did not intentionally do fentanyl. Fentanyl was laced into her heroin. So, I mean, it's rampant. It is everywhere. And we need to ask more of our government. Here we are pushing our California government and our mayor to shut down the open drug market, and we need help. We need help. We need education.
I mean, it's a big ask, right? It's a big ask. Help us shut down the open drug market. I mean, back in the 80s, there was a campaign, a war on drugs, and a just say no, and here we are.
But it shouldn't be a big ask. It shouldn't be a big ask to arrest dealers on the street that are selling death. It really shouldn't be a big.
Let me ask you, Amanda, if you can jump in here as well with this. You mentioned Snapchat. And this is something that I was unaware of, that a lot of kids are actually buying their illicit drugs through Snapchat. How convenient that the messages disappear. But social media is now not just a concern for our kids' mental health and bullying and possible suicide. It's now a concern for drug dealing.
For their health and their life. Yeah, absolutely. I didn't know until I lost Luca that it was being used for something so nefarious. I never thought that any child should have an encrypted app to begin with. But my son was allowed, and I felt bad taking it away because then mom's the bad guy again. I wish I had more than anything. But not long after Luca died, a young lady in the community, I had posted on my Facebook, right, about believing that the dealer that sold to Luca was grooming him to be an addict. And a young lady in the community reached out to me and she said, that's absolutely true. I used to buy from the same dealer. I only bought marijuana, and every single time I tried to buy from him, he would offer me perks. So, and she said that the menus just come up. You don't have to necessarily look for it because they're shared over and over and over again. So even kids that would not normally be exposed to it are seeing these menus for drugs.
When you say menus, you literally mean take a look at this menu and pick your poison. Honestly, it's like
Yes.
it's like a meme that's shared with a lot of people.
It is absolutely a menu, and it has all the little emojis that mean all the different things. You know, if you want ice, it's going to be a snowflake, and all of the different things. And they may seem innocent or innocuous to somebody who doesn't know what they're looking at, but for everyone else, yeah, they're menus of drugs.
You know what, Amanda? I'd like you to just go a little further with that. I know it's probably hard to do from memory, but whatever you can remember, just tell our viewers what other emojis should we take another look at if we just happen to see it in our kids' communications. You said the snowflake means ice. Do you remember some of the other emojis that stand for other drugs?
There are a few. There are, of course, the pill emojis. I mean, there are pill emojis in existence. And then you have, the leaves for weed, trees, anything like that, all along those lines. I don't have them memorized. I've avoided Snapchat and just, received menus and such from people in the community that were concerned that it was still going on. My son, there was an active murder investigation, and his murderer is being held for trial. So people in the community have sent me these things because they are worried about our community, and I have it in with the police. So somebody to actually listen.
And I think murder is an apt term. And in my line of work, which is covering law and crime, it's sometimes been so difficult to pin murder on these dealers because there is the chain of custody that is sometimes extraordinarily hard just to prove in a court of law, even though we all feel it in our bones. We know it when we see it. Just getting that proof of the pudding can be so incredibly difficult. Let me ask you, Michelle, about that, though. Our viewers might be saying, why on earth would a dealer, stamp a counterfeit pill with a lethal amount of fentanyl? They're killing their customers. So sort of that paradox just doesn't seem to make sense. What's the answer there?
So they're not trying to kill their customers. They're trying to get their customers to become addicted. And I have heard this over and over. They thought they were getting a Percocet, and then 4 hours later, they're calling to get another Percocet because they're dope sick. They're coming down and they need more fentanyl. So they're not, the problem is the kids first of all, aren't acclimated to high doses of drugs. So if a kid is getting what a person that regularly uses pills, if they're getting that same amount, then that's when they will likely have fentanyl poisoning. We call it that. We don't call it fentanyl overdose, especially for the young teenagers, because they aren't attempting. Oh, perfect. That's exactly the decoder
there
that
it
I
is.
was
We just
looking for.
found it. You know, we just found it. We wanted to put it up so that our audience could see. This is called the drug decoder. It's from the DEA. And then you can see the little emojis. You know, I recommend that our viewers right now who are looking at this screen, grab your phone, take a picture of this, and then study, because that's a lot of information to take in all at once and memorize. And I think we all really would do well to memorize these icons. Look at the parking one for Percocet. Who would have thought? Listen, Michelle Leopold, Gina McDonald, and Amanda Eubanks, I cannot thank you all enough for the bravery in coming out publicly and talking about this. I think it's extraordinarily helpful to me as the mom of teenagers, and I think to a lot of, there could be grandparents watching right now who are absorbing this information as well. And again, I said at the beginning of the show, it's not just kids that the DEA is warning about right now. This is just cross-cultural, socioeconomic, everything. Thank you to all three of you. I'm wishing you prayers and healing and success in the road ahead as well. Thank you.
Thank you, Ashley.
Thank you.
And if you're, want to drill down, read a little bit more about this, you can check out the latest issue of People magazine. It's coming onto the newsstands nationwide tomorrow. And it's got some very interesting coverage. This is the fascinating story, the faces of the fentanyl epidemic. And I urge you, look at those faces, and somewhere in there, you will find yourself or someone, in your family, somebody who is just so similar. And that's why this is such a tragic crisis.
Well, it's a sign of the times. The fight against the worsening fentanyl crisis is getting a new tool to keep first responders safe when responding to overdose calls. This detector allows users to stay a safe distance away while analyzing what substances they're potentially being exposed to. NewsNation's Alina Shirazi joins us now live with a look at how it all works. Alina, I understand that some departments are actually already using this.
Yeah, Anna, they are. And we know it's no secret fentanyl is flowing through the U.S. border. Last year, 24,000 pounds were seized at ports of entry. And CBP says that's double what it seized the year before. But not only are parents losing their children to the drug, law enforcement officers are seemingly susceptible as well.
It's got really lightheaded.
From rural Florida
Breathe in, breathe in, breathe in, breathe in, breathe in, breathe in.
to the streets of San Diego,
Yeah, it's a powder. Could be cocaine or fentanyl, dude.
the scenes of officers collapsing and gasping
Just breathe, buddy, breathe.
after coming into contact with fentanyl.
Oh, sorry. You're okay.
Hard to shake off.
I need Narcan. I got you. I got you.
That's why when Officer Lucas Bailey hits the streets of Denton, Texas these days, he's happy to have an extra tool in his arsenal.
It just really reduces the chance of you being exposed.
It's a portable handheld spectrometer that replaces the roadside chemistry kit officers used to analyze drugs for decades.
Whatever substance you're testing, you've got to open that up, take a specimen out of it, move it to a field test kit and test it. So you've got a lot of potential for exposure.
It's a NIC public safety kit. It's known as NIC G.
At Florida International University's Global Forensic and Justice Center,
Go ahead, open up the suspected container.
Kirk Grates demonstrates just how close traditional technology takes an officer to an unknown substance.
Pink over blue cocaine.
Yeah, I'll be honest, I never thought this was even possible when I first started my career, that you would actually be able to analyze a chemical or chemicals at a distance.
The handheld device allows an officer to stay back as far as 6 feet.
And the LDPE is a low density polyethylene. It's the actual container.
And it's not just fentanyl the portable device can pick up. Here it identifies meth through a car window and at a mock crime scene. Other dangerous chemicals and explosives in its library too.
I think it's 8,400 different chemical compounds that it can identify. And that spans illicit drugs, can be explosives, toxic industrial chemicals, chemical warfare agents and other precursors.
The science cutting down on arrests from false positives. And while some medical experts question if fentanyl exposure can truly cause these severe reactions,
she's not breathing. Hit her again.
There's no complaining about being a bit farther away from unknown hazards.
There's nothing to be sorry about. I got you, okay? I'm not going to let you die.
Back in Texas, the Denton Police Department's on year 2 of the pilot program with loners from Florida International, and it's already proving invaluable for undercover officers.
It gives them a better feeling about, one, the work they're doing is on the right path, right? I'm not buying pieces of peanuts when they're saying it's crack, or I'm not buying baby powder when they say it's fentanyl or something like that.
It's an excellent tool. It's keeping officers safe, and I hope everyone's able to get their hands on one.
First tonight, the Mexican drug cartels kill 1 American every 8 minutes with the fentanyl they push on our country. History tells us it's mostly poor rural whites, which means it won't be covered by the national media. By the time this program ends, we hope you stay with us for the whole time, 8 Americans will die. Coincidentally, the same number of Americans, 8, died this week in mass shootings by the most liberal definition of mass shootings. Of course, the fentanyl deaths are not covered. The mass shootings are. So tonight, we decided to try something different. We're going to cover fentanyl tonight the way most television networks cover mass shootings. Here we go. I'm Leland Vittert in Washington with breaking news. In the past hour, a chemical smuggled from China and sold by cartels in Mexico killed 8 Americans. The killers are still on the loose. Since we know little about the victims, it's time to put this in perspective. The FBI estimates this deadly product sold by Mexican cartels killed 25,284 Americans already this year. There are, of course, ways to prevent these mass killings by Mexican drug cartels, but our leaders in Washington refuse to act. For years now, Democrats in Congress and the White House have blocked legislation naming the cartels that produce and sell this deadly weapon, sell this drug, terrorist organizations. They, in fact, will not go after the cartel kingpins. In fact, the American president routinely talks about cooperation with the Mexican president, who also refuses to take on the cartels. We, of course, don't know if these 8 deaths this hour came from pills laced with fentanyl or the injectable drug. We don't know if it was 8 teenagers trying the drug for the first time. Again, we don't know who sold them the drugs, but we know exactly where it came from. Here's the DEA administrator talking about who the Mexican cartels kill with fentanyl.
Many of them didn't know they were taking the deadliest drug our country has ever seen. They didn't know that the prescription pill they bought from a dealer on social media was fake and actually contained fentanyl.
We don't know where the 8 deaths this past hour took place or where the 8 the next hour will take place. But history tells us the drug cartels prey on rural white Americans, mostly in Appalachia, as you can see from this map, but other parts of America as well. As we continue our breaking news update, we are now 6 minutes into the show. So the FBI estimates the death toll from the Mexican cartels will rise over the next hour. In fact, just in the next couple of minutes. Part of the problem is there are just so many loopholes to getting fentanyl into America, much like the loopholes for buying guns. The Border Patrol is too busy with illegal immigrants often to stop the flow of fentanyl in. So now it's sadly up to state officials to act where Washington won't. We bring in Idaho Governor Brad Little, who's now sending some of his state patrol to the southern border. Governor, why is it that state officials and local officials are having to take on this crisis, take on essentially these murders, when Washington won't act?
Well, we're doing our job to protect the citizens of Idaho from this scourge of fentanyl that's just exploding all over the country. And we know it's coming from the drug cartels.
Yeah, there's no question where it's coming from. And we've talked a lot about declaring them terrorist organizations. I'm wondering a little bit about why something that is killing 1,000 times more Americans than quote unquote mass shootings, by however you want to define them, doesn't get any coverage. 281 people have died in mass shootings, according to the Gun Violence Archive so far this year. 25,284 deaths from fentanyl this year. Do you think that has anything to do with the fact that the victims of mass shootings are more easily politically exploited than the victims of fentanyl? There's more political points to be scored?
Well, I spoke to a group of high school students yesterday, and with me was a mother whose son took one of those pills. Unbeknownst to him, it was a pill that he bought over the internet that was one of those lace pills that came from the drug cartels in Mexico. And I was actually on the DEA website this afternoon, and they point out the two cartels in Mexico that are doing that, and what's about to take place in just not too many hours from now is more chaos on the border, which means more opportunity for those drugs to be smuggled into all over the United States. We kind of know the routes. A lot of it's going to the east in the Midwest, but a lot of it is coming up through California, through the Intermountain West and across, and we're having kids die in Idaho as a result of that.